Ublatia Nunavut mute. Man aqua nutang Nuvan Nayakak to Nunavut Luani 12 Nguyutak Wanutat, Matak 8 Takwa Anya Unia to Nuvan Nayakaun to Katilukta Lugit Man Nayo Nunavut Luani 86 Nuvan Nayakak to 84 Iqalung Nitu Mamango King Ngaini. Takwa Nuvan Nayakaun Nertut Mamihimayut 71 Nguyut Katitlugitay mga Nuvan Nayapigalaw Mataban Yakalung ni Nunavut mute Kapiyaw Himayut Nuvan Nayataray Kutanita Hivudapami Kapiyaw Himayut Takwa Nunavut mute Taluktan 16,271 Hivudami Kapiyaw Himayut and Tuglia ni Kapiyaw Himayut 12,692 Aqua Kuwena Kunita Kwana how the Kobak Badla or Yagalwa Mata. How you malukta up the Kinamanuman Nayata Wangiman Takwa Tilio to Chapakata Nuvu mutat Pahichi Tangiluga Kataktik Tangilugitakwa Nuvan Nayakatut Tan Nuvan Nayak Ihumakosoni Inung Anya Laktichi Homan Kinamanuvan Nayata Wangito Kinamanuvan Nayami Aikli Wangito Takwa Ikayok Hinalawun Manuva Mutalukta Aqua Ho Mangata Actuana Kang Kituluktanut Takwa Malik Taukoyo Anya Telitichi Kun Malik Chela Takwa Kanigilo Tangiluta Agawang Michata Ugdaluk Tangiluta Anilo Tangiluta Nuva Villa Optakina Palmimatoami Atoktaluta Takwa Ilangit Kaputi Town Ayong Matamakulua to Takwa 18 Tani Iqaluit Ikayong Narap to go Tamap to Lukta Kapiyo Tanya Pugut Takwa Hanan Naungin Nelang Mingmant Nunumok Tanya Coming up the Takwa Nunumu Ilangin Kawi Hatchaluta Katingalo Tangiluta Ila Takwa Nunamo Opta Takwa Iglo Yamio Katibuki Henik Takwa Katinga Talawit Katinga Luatangiluta Inukanelni Takay Kachana Puhidunavo Mil Ilipinimene Chalohe Ino Kati Nagligit Chalago Ikayu Chalago Ove Hukpagluta but now we Hinalak Tarape. Today we are reporting 12 new cases and 8 recoveries of COVID-19. There are 86 active cases in the territory, 84 in Iqaluit, 2 in Kingnight. And there has been 71 recoveries to date since the outbreak started. So far, 16,271 Nunavut mute have received their first dose of the Moderna vaccine, and 12,692 Nunavut mute are fully vaccinated. We all know that no one wants COVID, and I'll continue to urge people to stop blaming and assuming about the virus and its transmission. However, I want to remind everyone about their responsibilities to do the right thing. We need to make sure we are doing everything we can to protect one another. Remember that your actions can impact everyone's health. Public health is everyone's duty. So Nunavut mute, please continue to follow all the measures we have in place. Mask up anytime you're outside your household, wash your hands often, stay home as much as possible, and get vaccinated. Have a safe and responsible weekend. Thank you, Nunavut mute.
Good morning. On Tuesday, we announced that after screening the boarding home staff and clients for COVID-19, medical travelers had been cleared to return home. Yesterday, we received questions and concerns about whether it is safe to stay at the boarding home now. It is safe. There have been no COVID-19 cases confirmed in clients from the boarding home. The staff who tested positive and those who are high-risk contacts are in isolation and will not return to work until they have recovered from COVID-19 and been cleared by public health to leave isolation.
Ulla sakku nagajawle kriminalo na sila wakata hawai sakta law tilugo tamata bimikana yakting ito yung biyuminilo. Nuwadyanak 19 mitako ana bila simayut ang ikarum naksiti tawlaw ngata. Ipat sapik apik sokto hatalaw ngay sumalo ta kasutilo tayo maulugan ang ikalo ang mga tamata bimiging niyaklo ni. Ulugan ang itok tayo kanino badyanak 19 minalo na tayo yung hasimangito tuyong misimayuni tamata bimig. Iqanaayaqtiin nuwadyanak taalaw tutay kualuluganak tuminak sa katiyaminiuyut aniteeliti tawayut ammalu iqanaayaq bimminuuti jaangitut kanoigunni nuwadyanak 19 harunniilaw nginniginni ammalu kanoy nginnaqartawlaw nginniginni anaaharnangittuleriyikkunnu anitteeligunnaili patakisianuutilaartuti.
The boarding home also has processes in place to reduce the risk of COVID-19, including enhanced cleaning, encouraging and supporting guests to isolate in their rooms. There are no visitors allowed, and current public health measures prohibit visiting around the city. Clients are asked to only leave for their appointments or to pick up prescriptions. Food and beverages are being delivered to the rooms. No one is allowed to gather inside. Only clients are allowed on the property, and social distancing is required while outside. Masks and distancing are mandatory, and staff that are currently working were not exposed and have tested negative.
Tamata bimmi malittaw yaalinni atayuta ko uluganak tumitaylitit sinirmo sa mataylitit sinirmo ko ilagiyawluti. Salom masaiga lan sa hatalatun amaluto yung miyuni namin ilogosang miningin natin si hatako yiluti. Pulaga tawga hangito amalok anaham nang ituliran ng malitaw gali namituin na tamanik ikalun ni pulak to kaya hangit sarto. Takwaluto yung miyut kisane ilogosang mini anigun nato initsalir tao bigis mayamin ulutano takugaluti ubalo iyagaktamin ni ay tsirun naluti. Nirinatang natang iluta ko ilogosing inut ataw watut kinatuin nas ilut tomatok bilo ani katiga hangit sa atun tuyong medyo lukisa ni tapang nuga hangit amalo ino katiga kanitay liga hat sa kanigitay liga hatak to sila may tilawin matuwas may nakayali tamalo kanit sa luwatay liga li taman nasa gobe hangit kumalitaw galing kanayak timan na kanayap tu ta ko katiyaw sa mga ito nuwadyanak tulimin ang numot amalo nalo na taw sa mga ito.
If you are a medical traveler who has been cleared for travel from Iqaluit, you are still required to isolate for 14 days. Members of your household must also isolate. This extra layer of safety ensures that the risk of COVID-19 spreading to other communities is as low as possible. Yesterday, the 2 cases in Rankin Inlet recovered, were cleared from isolation, and were able to return home. As of yesterday, there were 23 cases of COVID-19 at the Baffin iron mine, and staff from the Baffin mine will be transferred to the south to complete their isolation there. There are currently 10 cases of active COVID-19 at BCC. All individuals are stable and isolating on site. 3 people have been medevaced to Ottawa and are under treatment there. No other Nunavut have been admitted to hospital due to this outbreak.
Anna bila simaluti awla simagubit amaluhan awlagun nang nakatawluti kalunning alutit sulani teliga kakayak tuti uluni 14 ning takwalo ilumyo katitit aniteliga kakayang miyoin. Tamanat uluganak tumitay litit sinewyo taman nuwadyanak 19 asingin nunalin no sa maktitawla kunago. Ipatsak mako kayang sinang mekanoy gunniyang nakaktawlaw tu amalo aniteliga kakunir tu angik kami nulote kunak siluti. Ipatsa munot 23 ngulilaw tu nuwadyanak 19 li nuluyan ni Baffin land uyang narbingani. Iqanayak tingin uluyan uyang narbingani nutik taw na ito kalunano tayo mataw na nga anitelit nga titaw na aluti. Manayok huli uyut nuwadyanak 19 li kikiptalo ikayok taw bingani. Tako ilu natiksukas simangitut amalu aniteili titauluti tapani. Pingasut tako tuagang naktuku kangatayo ka lakti tau simayo arwam tamalu tau nani inuli saktau yun. Asing inu na vumiun unit tokas simangito tamatumunga pilugo.
We have been very clear in previous statements that it is important that people follow public health measures. Visiting and social gatherings are the main causes of spread in Iqaluit right now. These activities put people at risk and will extend the outbreak if they continue. Gatherings of individuals from different households can expose everyone at the gathering and everyone they live with to COVID-19. We are asking that anyone who has attended a house party in the last 3 weeks contacts the hotline and requests swabbing. Thank you.
Tukasinatsa sa samayang kausuri hatta samayan ni pimariuning ni tako malitaw ga hamning ni anna hamnang itularan mo malitaw ko yayo. Pulara hatta ni no hatigi lokate hatta ni tako piloang ako tayo sa mapalaning ni mannaw ya kalunni. Tamakko hanoili ko tayo loran ak tumiliktit sigutaw hatta to tamalu tamatuming ako ni uliktit sigutaw sa mapalaning mo ako ni kanang na to tilo nokak titaw ngipata. Kati-khatar ni tamakko illumi khatiging ito tamakko sa magbiutu inarahang katamalo kikulima tamakko David Joanasie ni 19 ni. Takko apiriya vukikulima illugiyaw yung may parde khataw simayo pinaso ako simayo ni pingasunik takko khawike khuyaw yo khala khuyaw lutite ko David Joanasie na mo khala we gunak mo khawi saktaw gumanrak luti. Kuya na mi.
Ken Driscoll, APTN National News. Dr. Patterson, there was some good news yesterday with the release that the Pfizer vaccine is now available to be used on teenagers, essentially. Now, in the NWT, they're trying very hard to get this vaccine to give to those kids. And in the Yukon, they're saying, well, why don't we wait for Moderna to get approved? Well, what's your department's strategy? Where are we at with vaccines for kids?
Driscoll APTN kun nito sa kuminatu nito sa law katatana Pfizer kaputi ang yaktaw sa malanga uvikalano nunat siya milutak kayo sigutaw na ang narasuti Yukon milutak kinasuti manili Nunavut mekano.
Right now we're looking at all options, including if there's an opportunity to use Pfizer in the near future for at least some children in Nunavut.
Mana ya tako nalira ko tutsani sumasasyo tugi lagi yaw lunita na Pfizer tamani Nunavut mi atok taw kun ng mga sukusong no.
The logistical challenges for that vaccine are significant. It has to be shipped and stored at -80. Once it gets up outside of that temperature range, even if it's in a freezer, it's only good for 2 weeks. Once it's thawed, it has to be used within 5 days. And so the difficulties in getting that out into remote communities, it's a big challenge for everyone. And so Northwest Territories, as of today, my understanding is they only plan to administer it in Yellowknife.
Tamakko pang natawag ang niyat surun natulari gayang katataman na sumalon na ko tinga ulak titawag hanga ulak titawag katawag hanga tamalo tukutaw simalo ni -80 mi khwas simalo ni khwa mi galo khate ma pinaso ako sa inamakgo ni kisay ni piugun na kayang amalo uloy talle matunga na tuktaw ga katawag suti manno yung sige tutino nunalin no ayong na kayang kisay ni to sa mayak kununat sa amigo pang nasimayo Yellowknife mi to atuin no gayang ngani.
Speaking of Yellowknife, Dr. Patterson, there's a major outbreak there right now, fueled in part by kids who caught it at school. I'm wondering, can we expect to see any change in the school conditions for Kitikmeot schools, considering that Yellowknife is a hub community for those communities?
Yellowknife mi tako sa mapalyan kay laki-lang ataylin na bimipigyak tuminiw na tawlo ni tako na rin nakailin na bimi kanu malitaw yala sidsok na mga takitak miyo ni tao nga tauvani yalunaif me tuttarbiqallaqimmata.
Yeah, we're obviously watching that pretty closely. We have not, beyond closing our side of the travel area, common travel area, or the travel bubble, we have not changed the orders at this point. If there's concerns about community spread and other things that maybe put Kitikmeot at greater risk, then we'll consider altering the measures at that point.
Taman nakaisaqpallangin naqtavu kisani suli matusilaungittugu tamakkuninga hanutuinna kisani ismaalunnaqtohaqqa tamakku aanneaharnangittuliqinarmu malittaugaali assitseqpalliaga yaqtavu nunalinnu issiarmartauliqunagu piluartumi khitermiunittau taima uluqianartimiilertitsittailuqulluta taman nakaisaqpallanginnarnaaqtavu.
Jackie McKay, CBC News. Following up on Ken's question about the Pfizer vaccine, do we have the capabilities to store Pfizer in Iqaluit?
Jackie McKay, CBC kunni Ken uqauseriqqauyanga piqqutigiqqauyanga Pfizer mu tamaani huaqautitaqaqayaqqa Pfizer mu huaqsima viugunnartuni.
Yes.
Could I ask a question to Minister Sheutiapik? Would you be able to update us on how your department is helping the Kutak Society?
Uqautigum naqitigiu qanuuquutakku ikayormangaatsu pilirivitsinni.
Pigiarumaqqa quyannami tuarumatsui qanayartivut amisuang tangini qanayaqalartillugi teikkua ajuqsartuni atsurtuni ikayuin qanayariaqattangata quyannami tuarumayakka. I want to start off by thanking our staff that are coming in to support vulnerable. So thanks to those staff. Without them, it'd be even difficult. I want to clarify first that as a department, we don't actually operate the shelters. We provide funding, and inutituha kainaku tana inulirikuluta aulat si khatangituang kahangitunu atuinautit khattaktugu kinaujani mamana pirialok tilugu khanuktu khatigi khattaktavu khanuikayugunna mangata. Every day there's been dialogue between our poverty reduction staff and the executive director of Uhuta. Kautama aulat siying Uhutakut ama teikwayak sutaili mayu khatika kautama uhalauti khattaktuit. I am proud to say, though, that with the support of our staff, there is going to be training starting today, actually online, in hopes that if need be, there's going to be volunteers that would be available if needed. Kuviatunga ulumi uharun naksunga ulumi pigialanga matailini atitsiluti kanui kayugiarun na mga uhutakunita na ulumi atuktaulangayok. We don't actually staff. Our staff don't work. And this is happening because of COVID. It's not the norm. Like many departments within our government, we're all hands on board, when we're no different. Tana nuva juang utirlugo nalunanga mailu na tatuk tau si magatta makwa ikanayaktivu kautama ikanayang kalwaktiligu hutakkunut kisiani suhay nuva juang umar ilu na tatuk tau si magatta tana isumagilugo hanuktu tana iliniago ti alakataw gaswako ikayo humamatawgalwa ili amisumata iliniak si mangitui. And hopefully through this training, they'll be able to better have potentially volunteers to assist. As we know, there was an outbreak with staff, and this is our way of contributing in hopes that in the future, there wouldn't be a gap. Man ikanayakting iuhutak kunni nuvadwa halaw tilugi matusimakay na laungata tana ilisarilugo kano ikaduk kita iliniatit sivugo tekwa amiswapi umata akilik sutawati ikayugo mga yaktui kisyan iliniak si mangimata tana ulumi atulangayavo.
Dr. Patterson, please.
the Tranter of the Canadian Press. In your opening statement, Dr. Patterson, you mentioned that anyone who's been to a house party in the last 3 weeks should call the hotline and get swabbed. Have there been house parties in the last 3 weeks? Are you seeing transmission through events like that?
Tämä Tranter Canadian Press kun ne hakkauguvita ko illumi parde hattartu minuna rassuti ohala hullugi pardeksima pata pinasaro sinni pingasusima yuni pardekto hattanga.
Yes, and we've been able to link a number of cases from some parties and then follow transmission into the household and through the household as a result.
Iqaluit majuta ko ilangi David Joanasie mayu party lautillugi samak biojumini yamalo illumi hati minute ko party meet to mini samak titsitalikoi.
Iqaluit has been under lockdown for just over 3 weeks now. What effects are you seeing from that lockdown?
Iqaluit pinasarusum ni pingasun ni matusimalanga kanu attu inahasima vatamanna.
The number of average contacts has decreased. Initially, the major sites of transmission were certain workplaces, and that's dropped off dramatically now. And the majority of transmission is within households or in those parties and gatherings that are still continuing to happen.
Tako ajiging ito katiyaw si mayo katsi naro pali hatta si malitut. Tayo mga pigalaw nga nekikanayak binasa magbiyo kakatta kunet to nginak saulik to. Kisa ni tamako sa magbiyo katta nirsayo ilumi katigi ni amalo party katta to ni.
Justin Patornin at Safe News. Are you able to provide an update on the number of contacts per case? I know that originally you said it was between 10 or 12 and it dipped. Where are we at now?
Justin Patornin at sa kung ni katsi katamako katsi katiyaw katta kayo to 10 may 12 mo nakakatta yu yati.
For much of the last 6 or 7 days, it's been 0 or 1 in most cases for non-household contacts. But there was a blip a few days ago from another party where the average was 3 or 4 contacts per new diagnosis.
Ilun nagalatita ko ulo ni 6 ni 7 ngusa mayo ni katiya halwa sa makatang ito balo ataw sa tuwa may katiya has mangitang kat miuta ka katingingip tamini kisa ni parak to kalaw tilugo nalo na ataw sa mayo pingaso ni sitaman dilo ni kati si kataryangi sa makbayo kumnakton.
Last week, I believe it was last week, you talked about the fact that teams are about 4 days behind the outbreak, not in terms of backlog, but in terms of tracing. Where are we at now?
Pinasa ko sa ulaw tuminulo ni sitaman ni king of may ni kayo gabi tamag kuning katiyaw katakto ni kawi saktaw yun ni taman na kanuilak ka.
The last time we looked at that was Monday, sort of something we do every week. And the difficulty at that point, the reality was that it was in a group of individuals, essential workers who are working 2 or more jobs, and how to track it when it's moving through groups like that is really difficult. And so it's not a useful measure for where we are early or where we were earlier this week.
Pinasa ko si ulaw tumila naggadya mita ko pinasa ko si lima pinasa ko si tamako ay sa katakatigo tamako katiya mina katak to pilo to mi kanaya kaya kalakit to timako ni ungatan ulo ni tamako kanaya li pilo ang wak to mi sa masalikutaw katak pala mata tamako ayok na katak to kikud ni katiya hap to mini mga takaw yiga soarengi.
The good news is we're getting all of the tests done either the day they're collected or the next day. Individuals with positive results are notified and contact tracing starts within 12 hours. And so we're keeping up on the work. The staff is keeping up on that part of the workload.
Kasi nito sa kuminak to tamako kawi saktaw katam ning ulo sa inaw taktaw katalang ataw balo ka pangani amalo katiya miningin ni kakay pingas 12 tungaani hawi sartau tsautigi sikhatarsuti tamatumunga angummatit saalertugu.
Trevor Wright, Nunavut News. Have there been any fines doled out for breaking public health orders in the context of the house parties that?
Trevor Wright, Nunavut News kunni taakkono akilitit siyo halauqa tamakkunanga siqimit siyo minirnianna harnangittulerin mumalittaugalinni illuni paardeqtoqartuminiutillagu.
No. Aga.
Have you guys gotten any further into finding out how how either of the outbreaks, either here in Iqaluit or Mary River, have started?
Hawilaw kita manunugad dyan na kano tamangas halunod tikinir mga balutay kung nuluyaw yung bingano.
No. Well, at Mary River, there would have been one or more individuals who arrived, were tested negative, and then were in their incubation period and later started to spread it. And that just shows that nothing is perfect.
Aga, tay kanino luya niyo yung bimit tay makay saktaw lo tilugi ataw si ungatano ni David Joanasie to hangin nakataw lo tilugo tay timingan ni tilugo sulikaw ilaw tinagoy tay sa mapalyan lektimini matay may kisilima tay sakit si may nakatangin mata.
In Iqaluit, we don't know exactly how or when it got here. We believe that it had been spreading for at least a few days, maybe a week before we were first aware of it. And we just ask everybody, if you're feeling unwell, if you have any of the symptoms of COVID-19, please contact the hotline and get tested. Because there were clearly a few people who had symptoms but wrote it off as, a minor cold, and that contributed to the spread.
Tamani halun ni sulikaw yung mga inatakangakut ang malokano sa mapala yung minulak ng mga ulugalan ni Allah balo ni pinasa ako siliman mi sa mapala ni yung markaw yung law tinago tayo may man hanoy guti halo tuwa ko sinupad yun na 19 hasoy guti tayo maukala hatta ko yung sitatsi mga ukala biyo yung mo Kaya sakta gumalusita ko ilangi hanu ingit so ito nakatalaw nga tanupa to naso iluti sunaba no ba Joanasie to hakti lektuti sa mas bala hatalam ng ata.
Minister Joanasie, please. Minister Joanasie, I'm wondering what percentage of the take-home packages for students at the schools are being picked up, completed, and returned? What's the pickup rate like?
Minister Joanasie, 80% ita ko ang kami nilinaw titsani 80 ay tsakatak si maban.
Sivudlong pa mitakwa nuvon ng joak naktuit mamisatya ko waka namigarwak puti. Takwa ro ilinyang namo hanggang kami piliraga jaw katang naktut sama piliraga jaw balik taktut. Nasa tim makingin ni pisimang ikalwak sa mga kisyan kuya katakwa ilinyang kami piliraga jaw jut tamakun ng kadisi balik tin ng matapang na utimin ni. Amaratek kwa hanggang kami ni piliraga balik jaw utakti balik katang na kulugit. Takwa kayo saktaw niya kulugit ilinyang ningi kadisi nakatya kulug. First of all, thanks for the question, and for all those that are impacted directly with COVID, I wish you all a speedy recovery. For the remote take-home packages, I don't have specific details on what percentage are being brought home and returned back to the schools. What I can say is I think it's been great to that schools are supporting remote learning at whichever stage a school may be, and we want to continue on that path and supporting learning from home. It's great to see that people are picking up those packages and returning them, and that will ensure that those are evaluated and continue on with their marks, because the report cards are ongoing, and the work that students are doing will be reflected in in their reports.
Minister Joanasie, this is the second year in a row for Iqaluit students where there's been a major disruption at the end of the school year due to COVID. And in Arviat, they had quite a long one as well. Is your department taking any steps to help those children get up to their grade level of schooling, considering that they've missed so much instruction time?
Minister Joanasie, makuni ukiuni itamane kalon ni abyak tao simalaki lang atailid ni akatang ningit amalak veni no Joana pilogo ta ko ilid ni akti kano ikayok ta bangum matigum na kulog ilid ni akti mini.
Tamakwa namitu na tiya nunak juari mami taman na ilin niyang na atok tao na kaksimamat so lunga si tukulin niyang na kayo si tao bilyangin na yakalak tilo amalo nalaw nang itok at sokong nakatak tutakwa ilangin soklo tabanilin niya bimi latang ikalak suti kisyani taman na ujjiri jabut ajiging ito ni soklo ajung igya kannakotinit takwa lo ko dyan na may rumalwak taka akviani atulok tamin ni unikakon naksisimamata tay ko nga soklo ututigilo ko kingang no ilin niya bimi pilakadyo yun tao tanda kano khawjilok tamin ni atula khawjitinin taw sakay ko naksimamata malo ilinak to kaji katimajingit taw katimakatigilugi taman na ko sa kajaw lang mimat kano ang mutigakan nakahapat ilinak ta khotibut ilinak nang meni kayo sinakcha khulugi. This is there's like most students from across the globe, we recognize some opportunities are maybe missed with in-class instruction, and my department is looking at ways on providing different supports, additional supports on schools that have been most significantly impacted. And I want to really thank the staff in Uptake particularly, who have been able to reach out to staff in Kingnait, for example, and shared their best practices on lessons learned throughout their experience. And we've also had teleconference through the district education authorities and discuss some of the ways on how we can learn from other examples and build on those successes.
Jackie McKay, CBC News. My questions are for Dr. Patterson. The Yukon is now allowing fully vaccinated people to skip self-isolation when they come to the territory. Does Nunavut have any plans to change rules for fully vaccinated people?
Jackie McKay, CBC Kunnik, Yukon Miligu, take a capios by you, Tamakin, Yanni Taylor, Hatara, Nintita Mata, Tamani Nunavut, Mitai Mapang Masimabe.
Yeah, they're bringing that into effect at the end of the month. And they're doing that based on a couple of things. There's a much greater proportion of the population in Yukon that's eligible for the vaccine, and their uptake is over 70%. That means that the risks for the Yukon are very different from what they are for Nunavut at this point.
Taman nagawa tulila to takyo nung wani takwa mako ni pig chutakalo ang wakto take amisu nekside Yukon me kapiyaw gumnakto kapiyaw hatak sa mamata malo 70% ang matano kapiyaw hatak sa malo sutik tamako ulo naktumi gutakam ni Yukon me adjung matali tamani ulo naktumi gutakam ni tinu.
We need to see a couple of things in order to make that switch. Number one, getting the vaccine uptake amongst Nunavut higher so that the risk is lower, and also the measurements of how much impact the vaccine has on the spread of the virus.
Taakko makkuun ni hau iqaarea harajartugu saqqiqqaarea harajartu tamanna asijjertauni aqqaataannas sivulliqpaaq taakko amisuunersait kapiyauqattarsimaliqqata ulureanartumiinginnersauqullugi amisuunersait ammalu hanutigi hau iqqaarea harajarmiigu tamanna saarmarpallianarmu asijjerutaujunnermanga kapiyaussimaneq.
Looking at the daily vaccine count, it seems that between 60 to 70 more people are getting vaccinated a day. Can you talk more about the uptake in vaccine? Is it enough? And it feels a little bit like we're plateauing on how many people are getting the vaccine. Is that something you're able to change?
Ulutama taako kapiyau hattartu hatsiunerartauningi 60 kubalu 70 ilahattangata taako naamappaat ubalu suqqapallaagunni iluaqqatamalu hanuilirneaqqissiamissuunersai kapiyau hattaqullugi.
Yeah, there was a big push to get more Nunavut vaccinated, especially here in Iqaluit, and that's what got them to about 80%. And demand or requests have now dropped off, but vaccine is still available first dose right now. And there's a large group of residents in Iqaluit who have received their first dose and have to wait a full 4 weeks to get their second dose, and that's caused that plateau. So at the end of the month, we'll see the numbers start to rise again.
Ja tuillarilaumnitinnu tamaani nunavummi kapiyauqattahuillu tapiluanguartumi iqalunni teema 80%-ingi kapiyaugunnarsivalliassimayu kisaani tamakkua hatsiinnaroqpalliassimayu kisaani tamakkua tuinnaugaluartillugi kapuuti amissuut iqalunni sivullerpaangani kapiyaussimayuugaluat pinasuarusi sitamanaalaortillugi tulliani kapiyaulaangata teema suqqaluarpalliagunniirsimakoinnartumaannauyu kisaani taqqiununguani amissuruukkannilaartutsaamiyuugaluat.
And just to be clear, the vaccine is available in every community, and anyone who would like to get vaccinated can call their health center and make arrangements for that.
Tukisina hullugu tamakko kaputi atuinnammata suli nunalilimaani annearbitsinnoqaalalussi initsaluurunnartussi kapiyaugumalussi.
Thank you. Can I just get a clarification on that 80% you just said? What is that referring to?
Summa 80% laqawi.
Sorry, that's 80% of adults in Iqaluit have received at least one dose.
80% ngiaqalummiu innai kapiyaussimayu sivullerpaangani ilai sivullerpaangani ugaloa.
I'm a transfer of the Canadian Press. Last week, there were 4 cases at Baffin Correctional Center. Now there's 10. Is that because you're finding contacts, or is there transmission within the facility?
I'm a transfer Canadian Press kunni pinasaarusiuyimi sitamatuinnauyummata David Joanasie kayoktauvimmi maannaqquliulengata teika katiyauyuminanniqauyissimaleengata ubbalu teikani saarmapallianinganu.
Most of the individuals diagnosed recently are people who were exposed before we knew that it was there. It'll be the mass screening that happens either today or tomorrow and screenings next week that tell us for sure whether or not there's transmission happening at the facility right now.
Taako amisuunersain taako naluneertaulortui katiyahartuminiuningin hauyilaortinnata David Joanasieharninganik taima iluumnati atangerlugi hauyisartauvallianiaqngata ullumi haupallu taima pinasaarusiulaartumi hauyigunnarsilaartigu teikani saarmapallianarmanga.
I'm wondering where we're at in terms of capacity. Are you asking for help from the federal government or any outside sources?
Pilerijutitsaharunnarninnu amigarsileqqiubbalu gavamatohakkunni ikayortaugumalaqi.
I know that the operations department or division has been considering that, but no formal request has been made at this point.
Hauyimagaloortunga teikuaulatsinnermu parnaayu tamatumingaisumatsarsiurutiharsimaninginni kisaani tutsiralaungittuissulai.
Dustin Matar, Nunatsiaq News. Are you able to say how many of these parties that your team has identified over the last 3 weeks?
Tässä pitää nyt että se kun ne hatsi parde hattam nangata naluna sigunnak hatsiarti.
I don't have a formal count, but off the top of my head, I think there's three parties.
Kauemman laingittuugalla kesään että sassima ju pingassuatti parde pingassuni parde hattartumini ujuni.
Just to be clear, 3 parties that I know have triggered or believe have triggered transmission. There may have been others.
Pingassusima ju taakkoa seammak biussima ju kauemma jatoakka singin ni parde toha hattatut saujugalla kauemman itatinni.
Asking individuals who have attended any parties over the last 3 weeks comes with it an admission of guilt. What kind of messaging do you want to say to those people about coming forward?
Taakkoa persuktau hattatillugi party miittumini ima sumalum naktut sama seammak biu juminiugia party miilluni kanoli taakkoa hautikiaqayaqigi.
Thanks. That's actually a really good question. And to be clear, that information we obtain through contact tracing will not be used in an enforcement fashion. So if somebody comes forward and says, I was at a party and I may have been exposed, I want to get checked, we will test them, we'll work with them to reduce the risk of spread and transmission, but we will not be passing that information on to law enforcement.
Ida na pekkutit siya vatukisinat siya hugakku tamakko tusa khattaqtavu katiyoyumin ni khawsaqpalle atilluta taakwa atuqtauga jangitui naqtarigiaru taulutik suulu party me tuqartuminu niraqtaupa taakwa khawsaqtaut siya tuinarayaqtu tammalu piliri khatigit siya rayaqtavu apersorlugi tamanna siya mapalle alikkanne kunagu ammalu tamanna palisikkunnu balu bailakkunnu khawsuga jangittu.
Trevor at Nunavut News, are you guys considering making any modifications to the beer and wine store with alcohol being a factor in parties, obviously?
Trevor right Nunavut News kun nasa joktaw ni sa batay na beer tabi wine tabi matuingan ni nga tamakko sa makbiyo katalang nga tapharde katakto ni.
No, that would be harmful.
Agataman na
So there's a few harmful effects if we close the beer and wine store. Some people will not be able to, some people with addictions will be put into withdrawal, which is dangerous and life-threatening. Others will go to bootleggers, which is less controlled than the beer and wine store and greater risk for transmission. And so for those reasons, we've always said that the beer and wine store is essential.
Takwa atuin ang lugayang atana beer tabi wine tabi matuyaw pat ilo atumi tamakwa ayulero tahaksimayo imelo mo lugayang aktumi lugayang ata malutimi nga taman nakaw ngilero tahaligayang ala ino gunet takhaw tuin na hangat ambalutako pirayan niku imelo ni nugat sa hakatakti tay maawla tawgun nang iluti ser marsinir sauga yang katatay kang nga ninubi khatakto ni beer and wine stormy. Beer and wine stormy.
Is there still a travel bubble with Churchill, and are there any risks associated with that? Or
Suliku jwangalo mo Churchill maawla khatak bitsawgun nakha balaw taman nauluga nakha.
Yeah, there's individuals are still allowed to go to Churchill and come back with the simple declaration. The risk right now is very low.
Itaw nga Churchill mo khatakun nakto itay man uti khatakun naksutillo na luna uti khatsyarlo tikisen man nauluga nak luang ito taw nga khataklo ni.
Ken Driscoll, APTN National News. Minister Joanasie, please. Minister Joanasie, teachers working from home are being forced to use a lot of their own internet data. I'm wondering, is your department taking any sort of steps to help mitigate that cost for the teachers?
Kentrisko EPTN kunni Minister Joanasie takoa go ilinnaartit siji kiaqqivikkuuruti minnaangi qaminniim minakiliqsiiqattangata uterbiuni usavaan.
Takwa hubbasinnersani ilisaqattaqtut tuutigiruarluga kai hubbasinni 11-12 mimanna tamani iqalunni angeqamini pilera titautilluga ilinnaartillu qarasaujaralaaqtitautillugi takwa ilisailingittau qarasaujaraqtitauqattaqtut ammalu ikiaqqivikkuurunnautanittau atuinnaaqarguititaullutit takwa tukis tusaqatsagi kannan qaitaanna maanna nunavummi 5,000 qarasaujaralaani pitaqalertugut taakkualu siammaksimal vallianearsu ilinniarbinnu taakua quvvasinnilinnain ammalu 10 stage 4 muqtuqariaqatuaruti taakkuattau parnattavu ilinniarnaulaartumu ukiaksaami taakkua qarasaujaralaaqtitaugunnaqajarmigu. Thanks for the question. As of now, we in our stage 4 planning, for example, here in Iqaluit, there's devices and internet capacity are targeted for grades 11 and 12, and as far as I'm concerned, these devices are also available to staff and to support remote learning. And in addition to that, just to provide a brief additional update on devices, we currently have 5,000 devices here in the territory and have distributed for grades 11 and 12. There's additional plans to target grades 9 and 10 for the fall in case those grades need to move to stage 4. So those are being planned for the fall time.
Minister Joanasie, what I asked about though was teachers using their own data at their own expense in order to access those systems. I'm wondering, for those who aren't getting the tablets, who aren't the grade 11 and 12 teachers, are you doing anything for them?
Minister Joanasie takoa ilinnaartit siji apiqqutigiqqawajakka akiliqsiiqattaqtu nammini takoa grade 10 and 11, 12 takoa ngungittui qano uterbiuqattaq nammini akiliqsortanginni kiaqqivilmun.
Maanakutaanna suliqimeqqusимангитавут аммалу тааккуа хуббасинна сану тугаангажуни атуиннақартисимагалуартиллута кисианиттау қаруннарсунга тааккуа нортвестау оқаалаусериликкут тукисигиар симаваллаа касуарсимаммата қану таманна ангеррами илинниарнеқ қарисауjakkullu аттуиннақарсимаммага нунавунми тааккуақай пилуартами stage 4 миттунут таманнаханерту осоорнартаваммалу иммаха кинаажартақатуаруни хинеқпаллиагалериллута тамаккунунга икалерсоруит каннерутиксаугалиартами. As of now, our plans are targeted for what our resources allow for, and that is to support grades 11 and 12, and then potential, and as I stated, in the fall time to support grades 9 and 10. Further to that, I just want to also state the Northwest Tel Company has approached the department to see what impacts there are being seen with remote learning and online the platform. It's being used in stage 4, those communities in stage 4 particularly. This is an ongoing discussion that we'll also see if there's additional, whether it be financial resources that we might be able to access to support staff or students in remote learning.
Jackie McKay, CBC News. My questions are for Dr. Patterson. You said the COVID outbreak at the boarding home was contained to the staff. Can you say how many staff contracted COVID and if it's impacted operations?
Jackie McKay, CBC kunni novadjoanartaarsima yuminiuneriiqqaugaviqqinayartiinnanginni tammaaterbimmi qatsiuvan.
It's under 5 people amongst the staff, so too few to report. There was concern for the first day or two of that it did impact operations to deliver food especially. And the reason for that is there were a few people who were positive, but then there were a number of people who'd been in contact and are also in isolation as a result.
Taman natu ina hasimaninga talle matungani ma okausari unnangi tabuhatsi uningi kisene sumalon na kay nalaw tupiga palle atillugo taman natu iga yamninga ni awla tayo no pilo aktumi nirik hatta mo tako ilangi kate yaw sima yumini ulaw ngata ni teliga hasimalaw ngata tayo na sumalon na kay nalaw tu.
Same question regarding the jails. Has that outbreak impacted any of the staff, and has that affected operations?
Tako ali anun latsivin ni hanu atu isima baula tauningin ni amigasilak sima bakina yaktini.
I'm not aware of how much impact it's had on operations. That would be a question would be better directed to the Department of Justice.
Kaya mang ito hanu atu ina hasima mga maligal rayikun na piringa akong naktuti.
And are you able to say if any of the staff tested positive?
Yakana yaktin no badjuanak tak sumayo hakka.
Too few to report.
Katsi na ulo ang ataw hausakay nang itaka.
And the transfer of the Canadian Press, can you give us a breakdown of the ages of those who have COVID-19 right now?
Ema transfer Canadian Press kun ni katsi ni ukiyo kakayong mga ato no badjuanak tak sumayo nalunayaw nakigi.
I don't have it with me, so we'll have to get that to you later.
Man napisimang imaw sa ako kay kung nalangayangi.
I know everybody's interested in the question. It's 30 now, 30 children, so under 18 is continuing to rise.
Itaman na to sa kumiya katam naksayo 30 ulit to itay ko 18 ni tunga ni ukiuli sa kusi no badjuanak to tak sumayo.
With 30 people under 18 who have COVID-19, what does that tell you about transmission and this outbreak? That seems like a high number.
Tako ami swalo yang ata 30 ulit to 18 ni tunga ni ukiuli ay makanutaman na tukihaka.
Well, I think it's 40% of the population of Iqaluit is under 18, so having 30 children being infected by it, it makes sense. What it tells us is that it's moved into households of permanent residents and is spreading inside those households.
Tako 40% ng Iqaluit ay mga 18 ni tunga ni ukiuli tako 30 sukusi no badjuanak tas mayo taman na to kisinak to galaw kisa ni tako ilumi hatigi ni sa maktaw si maninga ni hawi nakto.
Matar, Natsiak News. Following up on Eva's question, are you able to say if those 30 children, are those all active cases or some of those now recoveries?
Das tempetano na sa kunni tako 30 ni kakao yati sulita ko no badjuanak to kakao baloy lang ni hanu igon ni to kaksamalaka.
That's total cases amongst children.
Tako katilimang lugi so kusi no badjuanak tas mayo.
I know that it's in the public health orders, but I was wondering if you could clarify the rules on masks. For example, if someone's walking down the street by themselves outside, do they have to wear a mask?
Tako ana nangituloy na mamalitaw yali ito kisinatiga kay nakita mako matuwa pidyo tigilugi solo ino tulo ni pisulo ni sila mi matuwa si makatara ka.
Right now, masks are mandatory in all public areas, and knowing that lots of people aren't wearing masks at all, we're not in a position to ease those measures right now.
Mana yo tako asago behangit to me kikutuin na no pataw hatato ni nato ako ti matuwa si makatara ali asago behangit ko.
Trevor, I know what news. Are you able to say what the condition of the 3 people who were medevaced down south are?
Travel right Nunavut news kung ne haun nakita ko pinga su to avem natukko haluna no laktaw sumayo kanu mga taw haun nakhi.
No, I haven't had any recent updates on those.
Gaman na makuto sa laong itangi.
It's been a little while since the cases appeared in Kingyate. Would you say it's contained right now, or?
Dako kingang ni sir magbiw na sakto kalik nga tay mga sir mapalagun niyang nakakun nakyo.
Yes, it appears to be contained in Kingaid.
Kingang ni taman na sir mapalayo yakun nito.